You can see the way their face expression changes the moment they look at you and see, for example, your medical history or your mental health history or scars, or you know that the question is going to change from where does it hurt to are you hyperventilating? Is it your mental health thing? It's so frustrating. It's so frustrating. Even when I was in hospital on an IV with a double pneumonia, I was scared that it was fake because I just started to believe it. Apparently, this can be a form of trauma, or at least an experience that you can suffer from, and it can prevent you from getting medical help that you need. Welcome to boneitch. My name is Luca, and I make videos about what it's like to live with Tourette's. But today's going to be a bit of a different video. It's not going to be specifically about Tourette's. It's something that I think affects both people with Tourette's and people with other health and mental health issues. And that is medical gaslighting. I want to talk about this because it's currently still Mental Health Awareness Month. So I do want to talk about this issue in relation to mental health as well. And also because it has really affected me these last couple of months. So I want to talk about what medical gaslighting is, what my own experience with it is, and how it has affected me. Quick disclaimer, this video should not be interpreted as an attack at the medical field in general or as an attack at any specific medical professionals. As someone who has loads of health issues, both physical and mental health issues, I am so grateful for all the help that I've gotten through the medical field. I owe my quality of life to them. And at the same time, I don't think that means that we can't be critical about some parts of things that are happening within the medical field, and that we should not be able to speak out and that things can't improve. But yeah, I do believe that we should trust our doctors and should work with them. And this is not an attack at the entirety of the medical field. That's not at all what my aim is. So if you too feel that like this is an important subject to talk about, please leave a like, leave a comment, maybe share the video, because I might not be able to cleanse my language enough for the YouTube algorithm not to suppress this video. So you can help out by engaging with this video in some shape, way or form. That would really help out this channel and would help get this video in front of the eyes of people that might also benefit from it. So thank you if you'd want to do that. So what is medical gaslighting? Gaslighting, a bit more of a well-known term, is a form of manipulation of someone by making them believe that they are crazy, that to make them doubt their own experiences. And with medical gaslighting, it's when your doctor convinces you that your symptoms, usually your physical symptoms, are not real and that you're making them up and that you're crazy. And even though I wasn't really aware of the term medical gaslighting until quite recently, actually, I was quite aware of this problem. There have been many articles about how people sometimes don't get the care that they need, especially women, female presenting people, especially women of color, that they might not actually get the quality of care that, for example, cishet white men get. They get less painkillers when they need them. They are believed less and less, and they are convinced that their symptoms aren't real, that they're just crazy. And personally, I've experienced this as well. Both before my transition, as I'm also a trans man, and so before I transitioned, I experienced this, and I still do. And I think part of this is also because I also have loads of mental health problems, and it's a mess. Yeah, I want to talk about my own experience, just talk or just go over some of the things that have happened and how they have impacted me in how I look at myself and how I struggle getting help sometimes. And I think the first thing that really sticks out is when I was young, I already had loads of health issues. I had allergies, I had loads of infections always in different parts of my body, my kidneys, my throat, a lot. So I was sick a lot as a child. And I had a family doctor, a GP, that was not the best. I had a throat infection. It was getting really bad. So I went to the doctors. I think I was a teenager by that time. And he did not believe that I had that. He wouldn't even look in my throat. He just wouldn't even check it. And I know that at the moment that, or in general, doctors are getting more hesitant to give you antibiotics because people are using too much antibiotics and it's not good for you. And I already took them so often that I could understand if he was hesitant to give me antibiotics. But that was not the case. He did not even believe that that I was in pain and that he wouldn't even look into my throat. And I got really sick, and I was sick for months. I was in bed. I could not open my mouth anymore. My mouth was stuck. I was in so much pain. Yeah, it was horrible. And it turned out that I had an abscess in my throat at some point. But the time he finally took me seriously enough, I had to get rushed to hospital to literally have my throat being cut open without any anesthesia. And it was horrible. And yeah, just the experience of having that doctor already impacted me because I was kind of trained to believe that doctors might not believe you, might not take you seriously. And eventually I grew a bit older and my mental health issues became more visible. I have scars on my arm. I had an issue with food. I can't say those two words because the algorithm. So I lost a lot of weight and I was quite sick. And then I went to the doctors with all my symptoms. I already had therapy for those things, but my health was getting really bad. I could not walk stairs anymore. I was shaking. I was fainting a lot. And the doctor wouldn't help me. They just said, it's because of your mental health issues. And yeah, maybe it was just caused by that, but that doesn't mean that I should not get medical help, right? That therapy I had like once every 3 weeks was not going to do any good if I was going to faint all the time, not being able to walk stairs anymore. And I just remember crying and, oh. It stopped me from wanting to go to the doctors in general. And my health is just not, it's not the best. It's not. And still, I have like this weird like rule in my head that as long as I can walk and work somewhat, like if I can pretend that I'm all right and other people aren't negatively impacted by my health issues, I won't go to the doctors because I don't feel like it's bad enough. The one thing I had was, I think a few years ago, I was starting to get really bad like chest pains and it really hurt. Even when I was resting, I wasn't panicking. I know what panicking is like. I know my body, but it was getting really bad and it was, yeah, my heart was pounding. There is some history of heart problems in my family. So even though I actually didn't even want to go to the doctors, but it was late at night and I was in so much pain as well. And it just didn't feel good. And I asked a friend, like, should I go to the hospital? And they said, oh my God, please go, just go to the hospital. So I walked there but of course, it's usually quite busy there. So I was waiting for like an hour. But yeah, I wasn't feeling good. And I almost fainted and it was really warm in there. So I almost fainted. And I don't know about you, but if you're alone in a waiting room and you're in pain and you're fainting, you get a bit flustered because you don't want to faint, right? That's very uncomfortable. So by the time I was called into the office of the doctors, I was, my vision was blurring and I was not feeling good. I was sweating. And yeah, at first the doctor took me quite seriously. He was like, okay, you have chest pains, what's going on? And then I took off my jacket. He saw my arm and he said, oh, well, that's significant. And he just talked about my mental health and that was it. Even though I'm not panicking. It's been like this for days, and it hurts. And right now I'm fainting, so that's why I'm like this. Yeah, because he was just, well, you seem very distressed. I'm like, yeah, because I'm going to faint now. And he just didn't believe me. He was about to just kick me back out until I stood up and I fainted. So they put me on the bed and they checked my blood pressure, which was way too low, and loads of things were kind of off. Only then he took me seriously. He actually wheeled me in a wheelchair to the heart department by himself, which I thought was interesting because I don't think they usually do that. So yeah, that wasn't good. And these things make me not want to go to the doctors. And these last couple of months, if you've been around this channel a bit, you know that my health has not been good. My asthma has been really bad. And just in general, I've been feeling quite sick, very tired. Just not good. I don't really have good days anymore. I have maybe 2 or 3 good hours in a day, and it's just, yeah, it's not fun. So this week it got to the point that I really couldn't breathe anymore. It hurt. I was just so tired of it. So I called the doctors and I told them that. But by the time I actually got there, it was late in the day. They got me an appointment the same day. It was, late in the day. Doctor that I didn't know. It was a substitute doctor. Yeah, the first question she asked me was, do I work too much? And whether I was hyperventilating. And by that time, I was already so stressed out and scared that I was probably already hyperventilating, and I was really stressed, and I don't know, I felt scared that they would not take me seriously. That's of course what happened. It's stupid. I think for people that don't experience this, they might think that I'm making it up or that it's not that bad. But for people that have experienced this, you can see the way their face expression changes the moment they look at you and see, for example, your medical history or your mental health history or scars, or for example, the scars on my chest when they see I'm trans, and you can see like an eyebrow going up, and you know that the question is going to change from where does it hurt to, are you hyperventilating? Is it your mental health thing? That's it. I might be crazy, but I'm not that crazy. I know that face, and I know I should know my body. I mean, I understand that on paper, when you see lots of mental health issues, that it's a valid question to ask. But on the other hand, I've had these health issues for my entire life. I'm 30 years old now. I know the difference between panic and asthma, and even if it was just mental health issues, if that means that I can't breathe for 3 months and I can't go out anymore, I'm starting to isolate myself because I can't go out. I'm feeling too sick, and I might not get tested before the weekend, not be able to get tested. So I have to isolate myself constantly, and my quality of life is getting so poor. The reaction of it's all in your head, work a bit less. It's so frustrating. It's so frustrating. So yeah, I mean, this doctor, she was really kind. And I think part of it as well is that I get so scared. And so, what is it? Like kind of panicky, because I'm so scared that they won't take me seriously, that I present as someone who has mental health issues. So I know that I'm kind of, sabotaging myself by doing that. But I don't know how to stop it. Also, like with my asthma, I don't wheeze. I've never wheezed. That's usually a giveaway for an asthma attack. I've never had that. Even when I had like the worst asthma attacks in my life when I was in hospital, I never wheezed. And because that's kind of an atypical presentation of asthma, they just sometimes think it's not real. Even though, I don't know, by now, I hope, because they would know that I don't just go into the doctors every time I feel something. I never go. And yeah, so I told her that I know that I look like I'm panicking right now, but it's because I'm afraid you won't take me seriously, and I can't go home without something, without any perspective that you at least look at this. And I kind of felt like I was manipulating her a bit by saying that, to be honest. And I told her about having double pneumonia and being sent home, and then a day later being rushed into intensive care because I had a double pneumonia, and then being told off that I didn't go into the doctor sooner. I mean, so I told her about that stuff, that I've been sent home a lot. And when stuff was actually wrong with me. And she said, well, okay, we can do a blood test and I'll give you some medication for your asthma. So I'm on some medication now, which is already helping a bit. So that's nice. And I had a blood test. Don't expect too much from the blood test, but we'll see. I don't know. It's so weird. It's on this channel. I often talk about advocating for yourself. I get loads of comments from people that tell me that their doctor doesn't take them seriously, and I try to give them advice. But I always feel a bit hypocritical because I suck at it myself, and I know that it can be so difficult when your doctor won't even check it out. When they just when you get that face, that expression of nah, it's not true. I thought usually that the idea is that, I think it's good. I think it's good that doctors are aware of mental health issues and that sometimes things can be caused by mental health issues, and that asking about whether people have problems with depression or anxiety or things like that is very good, especially when your GP is proactive on that. However, when someone comes in with physical pain, I would think that you should also rule out any physical cause. And it's the way they present it. It's just the look, the sitting back and just starting to ask about your mental health and about work. How many hours a week do you work? And when I explain, it's like they don't even believe me when I say I don't work too much. You know, I can't anymore. I don't do anything. I just sleep. It's frustrating. It's so frustrating. On paper, I understand the questions. I understand it, that I have loads of mental health issues and I'm really tired and I can't breathe. It might be this. But on the other hand, I would like for them to believe that I know my body and I know my illnesses, and that I can tell the difference. And I might be wrong, but maybe don't assume that I'm wrong just because I have mental health issues. I wish I had usually in my videos, because I like to be educational and to give advice in my limited capacity of giving advice. But I don't know how to solve this. I honestly don't. My therapist actually told me that, not my therapist, actually my doctor told me when I told her about this, that you can get EMDR or trauma therapy for things like this, because apparently this can be a form of trauma, or at least something an experience that you can suffer from, and it can prevent you from getting medical help that you need, which I kind of like the idea. I might actually look into it. At first I was a bit like putting it on me, like putting my own experience on me, that doctors do this, so I need to get like training not to be bothered by it too much. But I think it's a good idea, because even when I go to like a good doctor, I already feel so panicky that it prevents that doctor from actually understanding what is going on with me. So that might be something that I might look into, that might be interesting to some of you as well. And I also think that doctors should be more aware of the fact that this is happening, not to get immediately very defensive about it. I don't think you're doing it on purpose, probably not. Like apart from that doctor that I had when I was just a child, who was just not cut out for this job, I don't think many doctors do this on purpose. But I think that they should be aware of the fact that people are experiencing this, and that it can prevent people from getting the help that they need. It might prevent them from trusting doctors and going to the doctors when they need it, going in early enough when things might be preventable, because you're just being told you're crazy, and the crazy part is that you start to believe it. I still sometimes think that I'm faking my asthma, because I've been told that. And even when I was in hospital on an IV with a double pneumonia, I was scared that it was fake, because I just started to believe it, that I was crazy, that I was just making it all up. And that's no way to live, especially when you have a chronic illness or chronic illnesses that never go away. To already be sick all of the time, but then also believing that you're crazy for thinking that and not taking the rest that you need, not getting the help that you need, the medication that you need. It's not good. And I don't think that helps anyone. So I do think that we should be more aware of this, and that doctors and maybe in training, they can look out for stuff like this. So yeah, what do you think? Have you experienced anything like this? Do you have any tips, any solutions that I don't? Because I would love to know that. Please leave a comment. Yeah, if you are interested in this topic or Tourette's or any other types of topics that I talk about, don't forget to subscribe and hit that notification bell so you get notified whenever I upload a new video. This is it for today. I love you so much. I hope you have a great day wherever you are. Bye.